everyone, welcome to the video lecture for euthanasia. So once again, I have a little bit outdated notes compared to yours. So I've got some handwritten things in the sides here, and yours might be arranged a little bit differently than mine, but we can still go through these and talk about the procedure of euthanasia. So euthanasia means an easy or a gentle death, and by no means do we mean easy for the owner. So it is always, well, almost always, a pretty tricky scenario in the clinic is euthanasia. So often owners are really upset and sad. They might have a lot of strong feelings of maybe guilt or anger or just sadness. So it's kind of our job to help them through this time. So it is certainly it can be stress-free for the animal, but it's certainly not really stress-free for the owner. So the decision to euthanize a pet is made strictly between the vet and the client. And usually that's going to depend on how the pet, what the pet's condition is. So fortunately, I've only worked at clinics that do have a policy against convenience euthanasias. So sometimes people want to euthanize a pet because they're moving to a building that doesn't take pets anymore, or they developed allergies, or they just don't want the pet. Those kind of things aren't really good, and well, I feel like good reasons for euthanasia. So usually those kind of situations we decline to do that procedure for the owner. I don't know, there are some clinics I think that might not have that policy. I don't really know because I haven't been into every single clinic. But I feel like for the most part, people that I talk to don't really do those convenience euthanasias. So the reasons for people, I think I might, maybe a little bit lower on, I think I have reasons that people decide to euthanize. So, things like illness or, the animal's in a lot of pain, that kind of thing are usually one of the reasons people decide to make that decision. Okay, so when we are doing a euthanasia procedure, the injection that we're giving that ends the pet's life, that injection is a type of anesthetic. So it is a barbiturate anesthetic, and what we're doing is overdosing them with it. So a barbiturate anesthetic, and we are overdosing them with that anesthetic. So this right here is the generic name. So pentobarbital is the generic name, and euthanol is a trade name. So euthanol is like a brand name of that drug, but pentobarbital is the active ingredient in the euthanol solution. So some clinics will dye their euthanol with just like some food dye to change it to blue, so that there's no possibility that someone gives a euthanol injection by accident, because there's no drugs that are blue. I've never found that to be necessary. We're just very careful with like our labeling of syringes. You shouldn't ever be using an unlabeled syringe, and if a syringe is labeled euthanol, you're not going to use that syringe, right? So I haven't found that necessary in any of the clinics that I've worked at to dye it blue. So there are a few different methods we can use to give that injection of the anesthetic overdose. Most commonly, we're going to use IV, so intravenous. Intravenous is really effective and it's really fast. So when you give an injection directly into a vein, it does not take long for that drug to start taking action. So often with animals, as we're giving that injection IV, they pass away while we still have some drug to give. So it is very effective, very, very fast, that route. We have another option. We have two other options though. IP, so intraperitoneal. Remember, that's going into just the abdominal space. So not into one of the organs in the abdomen, but just into the space around the organs. We're not typically going to use IP as our number one choice, but it is a method we can use. Typically it's going to be used for small animals, so things like neonates or like small mammals or exotics. We don't usually like to use IP because it is really slow. So whereas IV, you can give that injection and it's over pretty quickly, with IP it can take 15-20 minutes, sometimes even longer, for the animal to pass away. So usually the owners want it to be fairly quick, so an IP injection is not ideal for quickness. And then lastly we have IC, which is intracardiac. We're not going to do an intracardiac injection on just your average animal because it hurts to give an intracardiac injection. It hurts to inject into the heart. And as well, it can be difficult to get that injection right if an animal isn't really heavily sedated. So we're only going to use intracardiac in a really sedated animal or an animal that is like straight up comatose. So intracardiac is not the desired method in most situations. But it is an option if we need to get that. So let's say your animal, you're not able to get an IV, you might want to try IC. Okay, so let's talk about the procedure of euthanasia. Okay, yeah, it is laid out okay here, I guess. So our first step, well, I guess the first step, I hope I changed this on yours. I think it's probably more accurate on yours. I really just need to get some printer ink so I can print the newest ones. That would be nice. But the very first step is that we're gonna have a room set up and ready for the owner to come in so that they can walk right in and into that room. We do not want to have people waiting in a waiting area if they're going to euthanize their pet. Typically, they're upset and crying before they even arrive. They don't need to sit sobbing in a waiting room. It's uncomfortable for them, it's uncomfortable for the other people in the waiting room, and we don't want to make anybody uncomfortable, right? So if we have a room set up and ready for them, that means it has a nice soft, nice blanket, not something that has like holes in it. We want something that looks nice. We don't want something all flashy with like cartoon characters on it. If you have kind of more muted, subtle colors, that's going to be a better route to take. I will usually place a towel underneath the blanket that I choose because often animals after they pass will urinate. So I want something that's absorbent. Regardless of what my choice is, I want something absorbent. I'm also going to make sure that there's Kleenex and a garbage can available in that room for the owners. Some clinics have a comfort room, which is really nice. So they can dim the lights. They maybe have a couch in there instead of your typical chairs. So it's a little bit more of a homey feeling than like a vet office feeling. And that's nice for those clients that are, experiencing a euthanasia appointment to have a little bit of a more separate room. And then also, if you have a more dedicated room for euthanasias, if they come back to your hospital later on with a new pet, they don't have to be in that room with like their new puppy and bring up all those emotions again, right? So it's nice if you do have like a separate room for euthanasias. It's not always possible though. Especially in Winnipeg, a lot of the clinics are very small, so they might not have a room for that. So before the owner arrives, I want to make sure that I have the euthanasia consent form filled out. So I'm going to fill out everything except obviously the owner's signature. So I do have some examples of euthanasia consent forms. I posted a couple examples on Brightspace, so you can have a look at those as well. They're the same too, I just scanned them. Here's an example of a euthanasia consent form. So when I say filled out beforehand, I'm going to fill out the name, phone number, address, all the descriptions of the animal. So this says, I, the undersigned, do hereby certify that I am the owner of the animal described above, and that I hereby give the clinicians of Robertson Animal Hospital full and complete authority to humanely euthanize the animal. So basically, this is just consenting to the procedure. This next part says that you certify the animal's not bitten anybody in the last 15 days. That they can be a rabies risk if they have bitten. And animals that can't be quarantined must be tested for rabies. So we need to make sure they haven't bitten anybody. And then the last statement is just saying that they release the animal hospital from any and all liability. So I've read and understand the consent. They sign here and they write their relationship. So like owner. Some people will write like mommy or daddy, which I think is always kind of so sad and sweet. And then we witness it down here. So we just put our initials here. So that's one example. Oh, this is the same form. Hold on. I thought I grabbed a different one, but clearly not. Okay, and then here's another example of this one. So this is just a generic one. It doesn't have a specific clinic on here, but you put the client and patient information, the veterinarian, the date, etc. So again, this is just saying I consent to the euthanasia. And then this part talks about the options, right? So return the remains for personal disposition, so like burial, communal, private, please hold, I haven't made a decision. And then this asks about whether or not you'd want a post-mortem exam. So this is a form, it says basically the same things as this one, but it also works in a place for the owner to indicate their wishes. So I personally like euthanasia forms that have the options right on it, because then we can, while we're going over the form, go over the wishes for the owner as well. And that's kind of nice to do. Then it's documented all in one spot. So we're going to have those forms filled out. We're going to have a room ready to go. When the owner gets there, we're going to get them directly into a room and we're going to go over that form with them. So this is something that VOAs do, is go over the forms and you know, educate the owners about their wishes. Okay, this is all out of order. Yours is in a better order. So we'll get that consent form signed, and then we want to confirm the owner's wishes. So I usually educate them about all their options and then ask them what they would like to do. So we have a few options here. Would they like to be present during the euthanasia, or would they like to leave? Sometimes people want to leave and not see the animal deceased at all. Some people want to be there for the entire procedure. Some people just want to be there for the final injection. Some people would like us to do the final injection without them, but then they want to see the body after. All are okay options. Neither one means that the owner loves or didn't love their pet, okay? Some people just can't handle things around death and don't want to be there, and that's okay. And I'm always very clear with owners that whatever they choose, it's a personal decision and it's 100% their choice, and that we are not judging them on those choices, okay? Because some people I find get a little bit almost embarrassed, I guess, because they think that they have to choose, you know, to be there or something, but I don't want anyone choosing something that they don't feel comfortable with. Next, we can ask them about whether or not they want any mementos. So some people would like to take the collar off and keep the collar and the tags. Some people want us to shave some hair and save a lock of hair for them. Some people would like us to do a paw print. I did link a video from @Dove showing you how to get an ink paw print. Some clinics I know will do clay ones, and that's fine too. Clay paw prints I would charge for if you're doing them, because you need the supplies. But if you do an ink paw print, I think it's a nice thing to do, and you can just do that for free. I think that's a nice little memento. And then those kind of things we usually send out with like a card, or give them to them when they pick up the urn if they're doing a private cremation. So I've talked to them about whether or not they're going to be present. I talked to them about mementos, and I talked to them about how we're going to deal with the remains. So they actually have 3 options. I don't think I described them better than this here. So in your notes, I think I did get a little bit better here. So options for disposal of the remains. They can do cremation, which is the better choice. Well, not the better choice, but it's the, I guess, easier, more appropriate choice. So there's 2 options of cremation. Owners can opt for a private cremation. A private cremation means that the animal is going into the oven by themselves and they are being cremated alone. That means that the ashes produced from that cremation are theirs. Those ashes are then put into an urn and sent home with the owner. If they elect to do a communal cremation, the animal is cremated alongside other animals. So all the ashes get mixed up. There's no way to tell whose is whose. And then those communal ashes are usually spread on the property of the crematorium. So the place that every animal hospital I've worked for has used is called Precious Pets. And Precious Pets has like kind of a little forest area behind their property, and they spread the ashes in there. So I like to share that with owners so that they feel like that's not a bad final resting place, right? So some people are kind of bummed at the thought of their animal just being discarded, but it's nice to know that they are treated with respect and put in a nice place like a forest. Whether they choose private or communal, again, strictly personal question. So for instance, my husband and I brought a cat into our relationship, he brought a dog into our relationship. I mean, he loved his dog, I loved my cat, the end. I wouldn't say that one of us loved our animal more than the other. When it came time though for those animals to be euthanized, my husband really wanted to have the ashes returned for our dog. And that's fine. That's something that he felt like he wanted as part of the grieving process. That's something that he saw value in, so fine, we did the private cremation. I personally am not a person that cares about ashes. It's just not something that that really has any like sentimental meaning or anything to me. So like, and I'm not even talking just pets, like just anyone. That's not a thing that really appeals to me. So when my cat passed away, I elected to do communal cremation because my husband was kind of like, I mean, you do you, it's your cat. I don't think he really loved the cat that much. So he wasn't really keen on having the ashes returned to him for the cat. And I personally, it's not a thing I need. So we did not get communal cremation for the cat, but we did private for the dog. Does that mean that we love the dog more? No. Well, maybe on my husband's part. But no, it doesn't. Like, they were both really loved and treasured animals. It just kind of depends on the person making the choices, what they like and what they don't like. So either way, it's fine. I find lots of people, I think, sometimes think if they choose communal, will think that they don't love their pet. So if someone seems like they're having a hard time making the decision, I'll always say, you know what, both are really totally fine options. Like either way, we know you loved your pet. It's just a matter of whether you want those ashes back or not. And then I find that they'll be more comfortable to say, you know what, okay, I don't think we really want them. And I'll say, no problem. If they do select private cremation, they have the option to select an urn. So, oh shoot, what is it called? I just said it. The crematorium. Anyways, they have, I can't think of their name right now, but they have a urn book, and it has a lot of different styles in there. So there's a few that are included free, or you can purchase upgrades that are just fancier ones. So they can have a look in the book there and see. Precious Pets, that's what it's called, Precious Pets. So once we've confirmed the owner's wishes and we've gone over the consent form, we're gonna go ahead and collect that payment. We always wanna collect payment before we start the euthanasia, like the whole process of sedation and injections, okay? We do that for a couple reasons. One, it feels tacky to ask for payment after. So, like, hey, I'm sorry your pet died, can I have some money now? So it feels like easier to ask for the money beforehand. Also, the owners tend to not be sobbing deliriously before the procedure has started, whereas afterwards, sometimes they're like incoherently upset. So if we can ask them to pay at a time when they're a little bit more calm, it's a little bit easier for them. So if we can collect the payment in the room, like if you have a portable point of sale machine, that's ideal because we can collect the payment there. They don't have to go back up front. They don't have to wait around while other people are doing the payments for food or something. Once the procedure's done, they can just leave because they've already paid. And lots of owners do really value that. So once we've collected the payment transaction, we're gonna go ahead with sedating the animal. What I like even better, personally, is to have the payment transaction going on while I have the animal in the treatment area for sedation and IVs. Okay, so we're gonna place an IV catheter and give sedation. I think the order here is gonna depend on the animal's personality and like just the procedure in the vet hospital. I like to place my IV catheter before sedation if possible, because sedation lowers the blood pressure, which makes it harder to get an IV established. So if I can get the IV catheter placed first, I'm going to. If the animal's upset for any reason, I'm gonna sedate first, because then they can calm down and I'll be able to get that IV then because they'll be calm. So when we give that sedation, we wanna warn the owner if there's gonna be any side effects. So side effects, often their eyes will stay open, sometimes their eyes will become really dilated depending on the drug. Again, depending on the drug used, they might vomit, so I certainly want to warn them if that's going to be a factor. I personally like to use drugs that don't cause vomiting because that's just unpleasant for the owner to have to see. And then I can warn them too if the animal's going to seem limp or stiff after the sedation injection. So we give sedation for 3 reasons. Number 1, it's going to decrease the anxiety for the animal. Okay, it'll help them to not feel upset or worried, or dogs are like panting frantically, or cats are like meowing a lot. That'll help them to kind of help with that anxiety. It decreases anxiety. It also decreases any pain the animal might be feeling. Typically animals at a euthanasia stage in their lives are dealing with illnesses or pain processes that are uncomfortable for them. So if we can relieve a bit of that before they pass away, that's a good thing to do. And then also the sedation helps to relax the pet, which gives us an easier transition to death. So if they are already relaxed and laying down on their side, we can give that final injection and they can just pass away. Whereas if we have like a, animal that's pretty happy-go-lucky and standing up and looking around, and then we give them a euthanasia injection and they just keel over, that's not really very calm for the owner, right? That would look upsetting. So the sedation helps them to relax into death. Then after that IV catheter is placed, I usually bring the owner back, or the pet back into the room with the owner, and I give them like 5 minutes or so to say goodbye to their pet. So I usually check with them what they'd like. Would you like a few minutes before the doctor comes in? Would you like me to come and check on you, or just send the doctor in? Usually I find most people want 5 minutes and then the doctor to just come in with no one checking in on them. So I do whatever their wishes are. If they tell me I want 5 minutes and then the doctor comes in, I set a timer for 5 minutes, and then when that timer goes off, I tell the doctor to go in. So that way there's no accidental losing track of time and they've been in there for 15 minutes. And there's no doctor entering right after I leave, right? So that timer kind of helps to regulate the timing. So once the doctor gives that injection, a few things happen in the body, okay? So first off, we're going to kind of look at my notes on the side here. The very first thing that happens is that the brain and the sensation stop. That's because it's an anesthetic drug, right? So the anesthetic kicks in, the brain stops really feeling or sensing anything. Once that's stopped, then the heart stops. And then once that heart stops, then the animal has passed away. So usually breathing and heart stop kind of around the same time there. So you're going to see things like the muscles relax. So let's jump over here. When the muscles relax, that includes the urinary bladder and the anus. So be prepared for urine and feces. They will often pass some urine or feces after they have passed away. The eyes stay open. Lots of people think that the eyes are going to close because, you always have that iconic scene in a movie where someone's speaking and then they die and their eyes close. That doesn't really happen. The eyes stay open. If you've been to like an open casket funeral before and the human's eyes are closed, that's because they've been glued shut. So eyes don't usually close when the animal dies. Then sometimes, so the muscles are relaxed, but they also might sometimes have involuntary muscle contractions after the fact. So we'll see things like sometimes a leg will be kind of twitching or moving.